This morning, I'm honored to have with me in the studio Dr. Melanie Chandler from Mayo Clinic. And I just want to start off the show letting Dr. Chandler introduce herself so that she does a proper introduction and so that I don't mess it up. So, Dr. Chandler, if you would, tell our audience a little bit about yourself and your experience at the Mayo Clinic. And
Sure thing, Brian. Well, thanks for having me. It's good to be here. Like you said, I'm at the Mayo Clinic. I am a neuropsychologist there, which means that basically I spend most of my time seeing patients who are coming in because they've had some change in their cognitive or their thinking skills.
mm-hmm.
So that can be anything from folks that are getting older and they're worried about their memory, like we're going to be talking about more today,
Mm-hmm.
to somebody who's been in a car accident and had a brain injury, to recovering from chemotherapy, to all sorts of things that might impact your mental and cognitive abilities.
Mm-hmm. Mm-hmm.
So I've been there at Mayo for, going on about 11 years now here in Jacksonville.
Well, great. Well, we appreciate you taking time out of your busy schedule to be with us and just to be a part of our show. And this morning, we're going to talk about two conditions that affect our memory. One is called mild cognitive impairment, better known as MCI, and the other is called dementia. So if you would, take some time, educate our listeners on the difference between the two and, if any, the similarities that they share.
Sure thing. So mild cognitive impairment is a diagnosis that we give when somebody has had some changes in their thinking skills. As they're getting older, they have either themselves or a family member has noticed some change, often in their memory. It doesn't have to be their memory. It could be their language ability or ability to find their words. It could be problem solving or reasoning. And when we do an assessment, we see that it's not just a normal part of being now 70 or 80 years old. That area of their thinking is actually impaired compared to others their age. But that person is still doing pretty well otherwise, still taking care of their day-to-day stuff, Maybe somebody reminds them of a little thing here or there, but for the most part, they're still taking care of their own affairs the way that they always would have. That's the scenario where we'll call it mild cognitive impairment. There's another term sometimes the doctors will use called mild neurocognitive disorder.
Mm-hmm.
It means the exact same thing. Now, that's different from dementia or a major neurocognitive disorder. And that's where, yes, the person is having a change, memory, language, these different skills, and it has gotten severe enough that it's starting to impact their ability to take care of their day-to-day stuff.
Mm-hmm.
Right? So somebody has stepped in to help make sure that they've taken their medications or decided that, they really shouldn't drive anymore because they're getting lost or need help managing their finances because they're forgetting to pay things like that.
Mm-hmm.
Now, mild cognitive impairment and dementia are what we call syndromes, and that's just medical terminology for their descriptions of symptoms, not the disease that's causing them. All right, so the disease that's causing them is something different. So there's a lot of diseases that could cause somebody to have mild cognitive impairment or to have dementia. Now, the most common one that people listening have probably heard of is Alzheimer's disease,
Mm-hmm.
right? And so Alzheimer's disease is the disease that's affecting the brain that in the early stages might be mild cognitive impairment, right? So we'll say mild cognitive impairment due to Alzheimer's disease.
Mm-hmm.
But as it progresses, it becomes a dementia,
Mm-hmm.
right? When it gets bad enough, and then we'll call it dementia due to Alzheimer's disease. But there's other types of diseases that cause these syndromes. You can have Parkinson's disease when somebody's had it long enough can cause these kinds of troubles. Lewy body disease, vascular changes like having strokes, a number of different more rare dementias or dementia-causing diseases that are out there as well.
Hmm. And it's interesting that you talk about Parkinson's and Lewy body. My cousin, who is much older, passed away several years ago at the age of 71 from Lewy body, but initially had a diagnosis of Parkinson's. And so I would assume that it's challenging when somebody comes in to see you to come up with that diagnosis right away. It might take more tests, more screening, more time with the patient. Is that a good assumption?
Absolutely. And so when a person comes in, so usually the typical pathway of getting diagnosed is that somebody will bring it up with their primary care doctor, usually first. And that person will either send them on to somebody like me, a neuropsychologist, who's going to do the different testing, and I can talk a little bit about that. And they might send them at the same time or at a different time to see a neurologist to have more workup. So nowadays there's different brain scans, labs or blood work that can be done. There's other different kinds of procedures where we can get a pretty good idea from the neurologist's perspective, from the medical side, what might be going on in the brain, what disease they are having. And on my end, people come in and they do a number of different tests. So if you go in and you have, say, a brain scan of your brain, it doesn't necessarily tell you how well the structures of the brain are functioning. Your typical brain scan is like a photograph of the brain, right? They'll come and do the cognitive testing, the assessment with somebody like me to basically do different tasks to see how the brain's working. So on my end, I will look and see just how bad is that memory, or does the memory look fine for their age, or what other parts of their brain might be involved. And then I can talk about what disease that looks like, and as well as how severe or mild it is.
Mm-hmm. So I recently completed the Dementia Care Specialist program with Johns Hopkins University. It's an online course. Just so that one of the programs that I oversee is our Integrated Memory Enhancement Program, which we'll talk a little bit more about here in just a little bit. And then also we have our Adult Daycare Center, serving individuals, those two programs, serving individuals in the early, sometimes middle stages of dementia. But what I found interesting in that, a lot of different things that I learned, but sometimes a UTI could be responsible for the cognitive issues that somebody's dealing with. And so when I think of that, I think it's important that we don't get on WebMD and try to self-diagnose ourselves, right?
Oh, I mean, absolutely. And that's like why it's so important to go to the doctor and find out if you have any concerns, because the first thing that we're going to look for is what we call reversible causes of the cognitive impairment. So things like, is there an untreated infection like a UTI or urinary tract infection like you mentioned, or some vitamin deficiency or something else that, hey, if we supplement that, or depression. Depression can mask itself and look like somebody is having cognitive impairment, and we can treat that, or get help for that. So we want to rule other things out, look for other things that we can treat before we diagnose a dementia.
Mm-hmm. So I'll be 52 in October, and, I'm at this age now where maybe it's too early, but I'm starting to forget things, right? So I'll give you an example. Not too long ago, I was getting ready to eat lunch, and my typical lunch is broccoli, right, that I've cut up, and then some red grapes and some almonds, right? That's my typical lunch. And I typically have ranch dressing with my broccoli to dip in, because by itself it's kind of nasty tasting, right?
Okay.
But I have a little refrigerator in my office, and I usually have a bottle of ranch dressing, but I had run out. So I went to our kitchen that's there at our main site there at COA, where we make all of our meals on wheels and all the meals for our senior centers. And I went in to ask somebody for ranch dressing, and I could not remember the name ranch dressing. So what I ended up doing is I asked the person there, I was like, what kinds do you have? And then as he went through the list and said ranch dressing, I was, yes, that's the one I want. So should I have a legitimate concern? I mean, am I at a point with something like that I should see somebody and say, can you just maybe do some tests and see where I'm at?
So let me answer that by backing up and talk about what's common in normal aging first, right? Because just the same way as we get into our 40s, 50s, and beyond, most of us aren't going to run as fast and as far as we did when we were 20, right? The same thing is going to happen cognitively to most of us. And these are changes that we think of as being normal aging. The very most common ones that happen are, one, what we call some mild word-finding difficulty, or being able to pull up that name or that word when you want it, right? And so that experience of coming up with the word ranch dressing when you want it, right? Those sorts of things very commonly start to happen, particularly once we're in our 50s and beyond. And I think most of your readers can identify with, maybe it's a word or, gosh, what was the name of that actress that was on that show we were watching, or that kind of thing that would have come to you easily before. Just accessing it is more trouble. The other thing that is very common is just maintaining your concentration or focus the way that you did when you were younger. And the most common thing that people will express this to me as a concern is that what did I come in this room for phenomenon, right? And so you were doing something in the kitchen, you thought, gosh, I need to go to the pantry because I need this ingredient. In the 10 steps over to the pantry, you had 5 other thoughts about other things going on in your life, and now you're standing in the pantry and you have no idea you were there, why you're there, right?
Right.
And so that is not memory issues per se for most people. For most people, it is that normal aging phenomenon where you kind of just lost your focus on what you were doing. You retrace your steps and go back over, and you go, oh, yes, of course, it was the whatever it was, right? And then you go and get it. So those are just very common normal aging. Now, that said, if somebody starts having a lot of it and it gets to the point where somebody is having some trouble with basically communicating, finding their words, what they want to say, or they find themselves just having trouble completing tasks because they're bouncing from one thing to the other constantly and can't keep their focus, then maybe it is time to have it checked out. I think anytime somebody is concerned, it's fine to err on the side of bringing it up and having it assessed. You don't need to think, gosh, is that enough word finding, or is that enough going into my pantry and forgetting what I was doing? Bring it up, and you can have it looked at. You can also get what we call a baseline done, particularly when it comes to the neuropsychological tests or the cognitive tests. Particularly if you had any family member in the past, parent, aunt, uncle, grandparent that had Alzheimer's or some kind of dementia and you're worried about it, you can have a baseline. So the way the tests work normally is the first time you do it, I have to compare you to the averages, right? So you come in and you do this memory test. I don't know how your memory was 5 years before. So the first time, how's your memory compared to the averages, right? Does it look fine compared to others your age? Is it better? Is it worse? But if you do go in and have what we call a baseline done, or go ahead and have an assessment, then we do know, hey, this is how Brian was 10 years ago when he came in, and this is looking pretty good, or gosh, this is different than what it looked like when he got his baseline when he was here before. So that's not a bad idea to have done as well.
And I think in a previous conversation that we had before, sometimes it can be based on the stress that you might be under at the time, right?
Absolutely.
Yeah.
Absolutely. Mood, stress, not getting enough sleep, medications you're on from something, all these things can cause you to have some difficulty with your cognitive abilities often concentration, how quickly you're thinking through things, those sorts of symptoms.
Mm-hmm. So for anybody that's listening to the show, and again, it doesn't hurt to go and just kind of get that baseline, which you like you just described.
If you're worried, just tell your doctor, get it checked out.
Mm-hmm. All right, great. So one of the things that I wanted to talk about today is the HABIT program at Mayo Clinic. Mm-hmm. HABIT is an acronym that stands for, and correct me if I'm wrong, Healthy Action to Benefit Independence and Thinking. So if you would take some time, tell our listeners about the HABIT program at Mayo Clinic, tell us who's eligible, what does it cost, the length of the program, things like that.
Sure thing. So the HABIT program is something that I started with my mentor, Glenn Smith, up in Minnesota when I was at the Mayo Clinic up there. Gosh, going on 20 years ago now. Hate to say, but it's true. But essentially, we're talking about these diagnoses what I do most of the time in clinic. And that is people come in and they want to know, gosh, doc, is my memory normal for being 75 or is this not? And I spent a lot of my time giving diagnoses, right, saying this is mild cognitive impairment. And at the time, the standard of care, and it's still this way in many places, is, well, you have this mild cognitive impairment. It might get worse over time. Come back in 6 months or a year, and we'll see how you're doing. Mm-hmm. And, of course, the next thing people say is, well, what should I be doing in that year, right?
Sure. Right, exactly.
Should I be taking this supplement I got an email about? Should I be doing crosswords or playing the Lumosity or some other game, that they've heard about to do? And so I was coming out of a rehab background where I've been working with folks with head injuries and strokes, and I thought, there are some things that people can do to help themselves over this year. And so we worked to come up with what is now the HABIT program, one piece at a time, basically, to come up with what is now a 5-component or 5-intervention program. So HABIT is a 10-day program that we offer for patients that have been diagnosed with mild cognitive impairment to come with a family member. So it's usually whoever's closest. It's often their spouse, but it could be an adult child, brother, sister, best friend, any of the above, somebody that cares about them, that's invested in what's going on, and that comes to the program with them. And we do a combination of cognitive rehabilitation with the person that's having the memory problems, so strategies to help with the memory loss. So things that you can do to help yourself remember just, more functionally. Even if your memory itself isn't working as well, what can you do to help yourself compensate and to function well with that? So we do things like using planners, taking notes in certain ways, other kind of strategies that we work with folks on. And we also do some cognitive stimulations, cognitive exercises, doing these brain game exercises on the computer. So really trying to get at what we can do for the memory or the cognitive issue the person is having. We also do support groups during that time. So the person who has the diagnosis of mild cognitive impairment will go and be in a group with other people who've gotten that diagnosis. And people will tell me, gosh, I've never met anybody else who's gotten this diagnosis before, and it's so nice to have somebody else who gets it to talk to. So this is in a group format, and so folks will get to talk about that, what it's like, what the fears of the future, the anger at what's going on, or whatever emotions it brings up, right? And then their family members go into their own group. So these are folks who are trying to adjust to this idea of, am I about to become a caregiver, or what is in our future together? And so they are processing all the emotions that brings up, right? We also do wellness education each day, which is basically there's a topic of the day where we talk about what's the latest literature and information about nutrition or exercise or sleep or other things to help with healthy brain aging. And finally, we do yoga. And we do yoga, one, because physical exercise has been shown to be so protective of brain health, but also we like to do things to help prevent falls. So we do a chair-based yoga with a lot of leg kind of strengthening activities and stress management, because like you mentioned before, stress can worsen this and the experience of it, not just for the person with the mild cognitive impairment, but also for their loved one, right? And so we're all in this together. They do these activities with their family member for the day and meet with me and my team, and that's what we do. And the 10 days is either we'll do like a condensed version over 2 weeks, particularly for a lot of folks that come from out of town to do it, or we'll sometimes spread it out over 3, sometimes even 4 weeks, especially for our locals who, don't want to, they want to have a little bit more time in between and not to take it so, day after day.
Yeah. And so you do have folks that travel from different parts of the country to come and be a part of the program.
Absolutely. Yeah. It's great to see it. I love it to see folks come because they've heard about it from their doctor, in South Carolina, or, they happen upon us online or something, and so they're joining us from Milwaukee or wherever. But it's great to have people come. Now, I wish that there were more centers that offered things that people didn't have to come up with ways to travel this far, but it's also a real privilege to get to not only work with our local community, but from folks around the country as well.
And then as far as like the cost of it, how much does it cost for somebody to be a part of it? Does insurance cover it if somebody has the right type of insurance? Or
it's a great question. The $1 million question. It's not $1 million, but the $1 million question people want to know, right? So it's a combination of things that we bill to insurance and typically don't have any difficulty getting reimbursed, especially most folks are Medicare, and we don't have any issue for like the cognitive rehabilitation, the group therapy, but not everything that we do during the day is something that Medicare pays for, right? Like doing yoga together or doing brain exercises on the computer necessarily. So there is an out-of-pocket expense, and that is $650 that people pay. And that amount has been, it's not insignificant, but it's been brought down by some donors in the past who wanted more people to have access, and so have given us some funds to help other people come at a more reasonable price than it could be. So people often ask, well, if my insurance covers it, do I owe the $650? Well, they're two different things. It'll go to insurance, and insurance will pay that part, and then the $650 is the $650 in addition.
And then do they need to have the diagnosis in order to be a part of the program?
Yes, thank you. Absolutely. So a person needs to have the diagnosis of mild cognitive impairment to participate, and they need to have done the neuropsychological testing, and that is the detailed cognitive testing. And that's because it's cognitive rehab. I need to really know when I'm going to work with a person, not just what their areas of weakness are, but what are their strengths. So, hey, this person's having memory problems, but they're really strong with their visual and verbal skills. So how am I going to lean into their strengths to help them come up with the best strategies for them, right? And so we do need that diagnosis, and we do need that detailed testing to know who and what we're working with to help the person best.
And so somebody out there listening today that wants more information about the Habit program, how do they find out?
Good question. And so they can go and just Google or search up in whatever search engine you use, right? Just the Habit program and Mayo Clinic. And that's probably the easiest way that you are going to find us, because the website through Mayo Clinic Connect, which is kind of Mayo's social media page. So that's someplace else that you can look up, Mayo Clinic Connect, to see all kinds of things about Mayo. but it's quite the lengthy email address
Yeah.
or web address to read out to the listeners. So just look us up at Habit Program at Mayo Clinic, and you'll find the contact email for us. You'll find phone numbers to call as well.
And is there typically a waiting list?
We do get full, and we go to a wait list. So we offer the program every other month. And so we try to keep people from waiting very long because, namely, people want to get in as soon as they can to any kind of doctor's appointment, right, when they're interested. But we know that the sooner somebody participates, the milder their condition is, the most benefit they're going to get out of it. And so we don't want people waiting months and months after they get the diagnosis and for their memory to be getting worse before we intervene, right? We want to get it on as soon as possible. But yes, we typically will, especially as we get closer to a session, go out to a wait list. But we move people through pretty fast.
That's great. Well, one of the other things I wanted to talk about, as you're aware, St. Johns County Council on Aging, we developed a program called the Integrated Memory Enhancement Program. We refer to it as IMEP for short. And it's for those with MCI. It's also for those in the early stages of dementia. We have 3 locations in St. Johns County, and we also have an IMEP at home version. Currently have about 70 participants. You've been a supporter of the program over the years. You've referred some of your folks that have gone through the Habit program to us. I'm just curious, what is it about the program that you feel is beneficial to somebody that's MCI or in the early stage of dementia from your observation and what you know about the program?
Yeah, and I would start by saying I think that we've had a good relationship with the Council on Aging and Habit both ways of supporting, sending folks that have been through Habit, you guys' way to IMEP, and IMEP sending folks over to us. So we've been good supporters of each other for, going on several years now. For IMEP, I've gone out, I've seen IMEP, I've had several patients that have gone through it and said wonderful things. It's a combination of many things that are similar to Habit. It's not exactly like Habit, but you're doing some cognitive exercises and cognitive stimulation with folks with some different kinds of activities that they do and mental activities they do. There's the physical exercise component of it that they do during IMEP. And also an important piece that is kind of woven in Habit, but also woven in you guys, which is the social aspect of it, because it's in a group. And time again, I hear from my patients who come back and have done IMEP that they were perhaps a little unsure what to expect. And that's what we hear for Habit as well. Unsure what to expect. But gosh, once they started going, it was so much fun.
Yes, yeah.
And they enjoyed. It felt like playing games and doing fun cognitive activities with other people and getting to have that social time while they were doing it in IMEP that keeps them going back. And I think that is, fantastic. And the best kind of endorsement is when your patients come back and tell you something positive,
yes,
right?
Absolutely, yes.
And so that's why we definitely tell folks about IMEP, whether they're coming through Habit or they're just coming through my clinic. Making sure they know it's available to them, especially if they're down here in St. John's.
Yeah. Well, and, you had mentioned with the Habit, you have folks coming in and they say they haven't met anybody else that has this diagnosis. And so we find the same thing with IMEP. It's just they can come in and they're around folks that have a similar diagnosis, maybe not the same type of diagnosis, but similar. They're dealing with cognitive issues, and they can kind of let their guard down, right? And because the person sitting next to them is dealing with something similar, and they might be a little bit further along in their journey or in the just in the beginning part of the journey, right? But they're able to. What we see is they just come in. They're apprehensive at first, but once they get in and they kind of relax, and they do, they just start to enjoy it and enjoy themselves. And then that socialization is just so helpful for them.
That's right. It's not uncommon when people are starting to have memory difficulties or cognitive difficulties that they start to withdraw. Sometimes they do it without realizing they're doing it. Sometimes it's on purpose. It's intentional because they're worried that they're going to go to their book club and they're not going to remember somebody's name, or they're not going to remember what they read about, or whatever kind of activity they normally do. And so they intentionally start to pull back. But the science shows that folks that are more socially engaged are not lonely, but feel connected to other people, have better cognitive outcome, have lower risk of dementia. And so we definitely want to fight that tendency to want to withdraw. We want folks around other people, socializing, and doing that for their brain health, but also their quality of life.
Mm-hmm.
They have fun, right?
Yeah.
They enjoy going out and being around others and being in a group, whether it's IMEP or Habit, where they can feel it's a safe place because other people are experiencing changes and they're not going to feel judged, but can have fun and enjoy the time, what they're doing.
Because we've heard some folks share, that they get the diagnosis and then it's evident to friends or family what's going on, and then the friends and family or their peer group, they don't really know how to respond to it, right? Mm-hmm. And so then they start acting a little bit awkward when they're around them. And so they've said, and then coming to IMEP, and especially some of the caregivers, right? Some of them have really formed a bond with one another because they're going through the same thing. And so, you mentioned in your Habit program, you divide them up into different groups, the people who have the diagnosis and then the caregivers, so that they can really just kind of, talk about their emotions and see that, hey, somebody else is going through this as well. And I think that helps them, give them the support that they need.
Absolutely. And Habit's a 10-day program, but we do monthly what we call alumni groups, where anybody who went through Habit can come back, and we do a day of groups for our alumni, and they really form bonds and people who've been coming back for years. And what's fun is when they also start doing things outside of their time with us, right? And you have these, couples or different families that make friends and kind of get through this experience together.
Yeah.
Kind of doing the best that they can with cards they've been dealt, but really enjoying a much better quality of life than they at first envisioned what it was going to be.
Mm-hmm. Well, Dr. Chandler, thank you so much for taking time out of your very, very busy schedule to drive down here to the radio station, which is kind of out in the middle of nowhere if you've never been here before. So thank you for doing that. Thank you for partnering with us. We love sending people your way for the Habit program. We appreciate you sending folks our way for IMEP or even for our caregiver support program that we have through Council on Aging. So thank you very much for being here today.
Sure thing. It was fun to do. Thanks.